My name is Francisco Rodriguez. I'm the Managing Director of Igenomix in the Middle East and in India. I'm based currently in Dubai, and we have a laboratory in Dubai and in New Delhi covering these two markets. The reproductive genetic field is in a process of getting more and more professionalized. When we started like 5 years ago, we strongly invest a lot of time, effort in educating the doctors. Now doctors everywhere in India understand about genetics and understand the role of genetics in the reproductive fields, and they are right now applying these genetic tests and services into the reproductive field for better outcomes. What we are right now seeing is that there is an improvement in the implantation rate and the reproductive outcome and successful. We started from 30% of implantation rate in the IVF industry, and right now we are observing how this has improved to 50 and up to 70% of implantation rate, especially when you are applying genetic services. When you are applying genetic services, you can identify the best embryo to transfer without any abnormality, and obviously the implantation rate increases up to around 100%, 60% of improvement applying genetic services. The most important barrier we face is about the knowledge about genetics. Genetics is a topic that doctors don't feel very comfortable dealing with. But with educational material, with people and technical people explaining in depth the technology and the benefit using, doctors are adopting more and more these tests in the day-by-day reproductive field. So educational efforts are key, and obviously cost and affordability are key to expand the use of genetic services. Government must support public institutions and public entities to use genetics to be leader worldwide and in India with the use of genetic services in the reproductive field. They must be the first one promoting this kind of genetic benefit. My company is a company that provides genetic services. We have a local laboratory. We do local tests in Delhi, and what we do is we educate doctors, we support them dealing with the patient and improving the condition to get the pregnancy better, sooner, and the idea is to have a healthy baby at home as sooner the better. So we are the best company for them to apply the latest technology and the latest genetic services. We are in the reproductive field in IVF and also in obstetrician, gynecology, and the latest in the pediatrician. The most important thing in India that we face and we are facing is the balance between cost and quality. When you must apply genetic services, you must apply them in a quality scenario. You cannot forget about the quality of this test, and then always we need to compensate the quality with the cost. So we need to bring the best quality services at a very reasonable prices. Affordability in India is extremely important, and we need to bring specific, high quality, latest technology services at the best price for the patient. Cost is key, especially in India. Affordability for these genetic services must be adapted to India, and we are making a lot of efforts since the beginning. But as I have said before, we cannot forget about quality. We don't suggest for the patient a very cheap test without a quality. We cannot do that. So the idea is to bring the best quality, the latest technology at a very reasonable cost, affordable for the patient. There are two main areas, as as I have said, the endometrium for us is key to understand the conversation between the embryo and the endometrium and access to a healthy pregnancy. And the other area is the whole genome, the genome. Nowadays, we are talking about the whole exome, and the whole exome is looking at around 22,000 genes in a human being to analyze genes and variants causing cancer in the future, neurology disease, inherited disease to have an affected child. We are moving ahead of that, and we are going to the whole genome. The whole genome identifies any mutation, any variant that can be present in a human being. And we are developing panels for cardiology, neurology, oncology, also pharmacogenetic. That is something that is coming and is the latest topic in this industry, and obviously inherited disorder to to be a healthy baby, to avoid having an affected baby.